Hello, everyone. Welcome to the Imaging Wire Show. My name is Jake Fishman. I'm the host of the show and the editor of the Imaging Wire newsletter. And we have a great episode for you all today. We have Dr. Rick Abramson, the Chief Medical Officer from Annalise AI, joining us. And I think a lot of you folks already know Dr. Abramson and the work that he's done and the things that he's done in the AI and radiology space. And today we're going to be talking about AI in particular and some of the big changes that are happening and are going to be happening. And let's just jump into it. Dr. Abramson, welcome to the show.
Thanks so much, Jake. It is great to be here. I am a huge fan of the Imaging Wire, and recently I've become a very big fan of the Imaging Wire YouTube series. I was just watching. I was watching the episode just earlier with Geraldine McGinty and Mars Panner on imaging access and health equity. I thought that was spectacular. We got big shoes to fill here, but we'll see how we do.
We sure do. Well, I'm glad you're enjoying it. You have great taste in radiology newsletters and YouTube series. So let's just jump into it. So for the folks who don't know you and are getting to know Annalise AI, maybe you can give a quick introduction to yourself and your company, and we'll go from there.
Sure thing. So as you said, I am currently Global Chief Medical Officer for Annalise AI. And I need to say at the outset that there is, as you know, a lot of hype about Annalise, a lot of accolades coming our way, and I can take credit for none of them because I've only been at the company for about 3.5 months. So, you know, everything that's all the buzz about AI, about Annalise AI is really, it's testimony to the hard work and dedication from the global team. Nearly 300 individuals across the world that are united around a singular mission of elevating the standard of healthcare for millions of patients every day. So get that out of the way first. That's my disclaimer that I take no responsibility for anything good about Annalise. Maybe something bad, we'll see. But in terms of me, in terms of my background, as you know, I'm a subspecialty diagnostic radiologist by training. But I've had this unusual career where I've kind of jumped back and forth between the clinical and the non-clinical worlds and back again. So my original interests were in health services research and health economics. I did some early work very early on in my career in health policy in Washington, D.C. I was a management consultant with McKinsey & Company. Then I went back, finished my training, finished internship, residency, fellowship, business degree, all that good stuff. Came out on the other end right as the teleradiology industry was taking off. So I did the teleradiology thing for a couple of years, ended up founding a management service organization, a small MSO with the founder of Nighthawk, Paul Berger, a very good friend and longtime mentor of mine. We did that for a while. I was recruited to Vanderbilt, served on faculty at Vanderbilt University for many years, doing the clinical research, admin, kind of triple threat type thing. And then I flipped again back in early 2019, was recruited over to HCA Healthcare, which for your international listeners is the largest for-profit healthcare system in the US with 185 hospitals across 22 states, recruited in by the CEO to develop and run a radiology service line on behalf of HCA's Physician Services Group. So I did that for a while through COVID, and then I jumped into the startup world, led clinical strategy for Covera Health for a couple of months, and then most recently came over to Annalise. So that's my background. Again, very unorthodox, but it's allowed me the kind of really unique opportunity to see the healthcare industry from a bunch of different vantage points. So yeah, look forward to kind of getting into some of that stuff during the discussion. And then Annalise. So Annalise is a healthcare artificial intelligence company based in Sydney, Australia. Like I said, nearly 300 employees across the globe. It is a product of a joint venture between Harrison AI, which is a venture-backed AI company, and the iMed Radiology Network, which is the largest private practice group in Australia. We currently have 2 core products, a chest X-ray product and a non-contrast head CT product. And really the differentiator for Annalise is that the company is committed to building these broad multi-finding algorithms that extend across an entire modality. That's really kind of what sets apart Annalise in the current market climate. And I know we'll get into some of that stuff later on. But you know, a lot of excitement coming Annalise's way. And we're actually a finalist for the Ant Mini Best Radiology Vendor Award, Best New Radiology Vendor Award, and they'll make an announcement next week. We'll see if we won. But long story short, really exciting time, and a really nice opportunity for me to kind of bring some of my my skill set from earlier experiences to bear on a really exciting company.
With these different seats that you've had within the industry, you've also had a front row seat for AI, and I'm curious. Obviously, it's young in terms of healthcare, but maturing quickly. Where do you see us in terms of the evolution of AI, and what do you see as that next step of the evolution, the step that's happening right now?
Yeah, it's a great question, Jake. And anyone who's kind of just kind of glancing at the radiology space can kind of see all this rapid evolution in AI, and it can look like just a blur, right? And it's hard to kind of make out what's happening. But those of us in the space and those who kind of like scrutinize the space and really follow it, I think recognize that there's kind of like a step change evolution at play, at least from my vantage point. That's what it looks like. I think we're seeing kind of a punctuated equilibrium where the prevailing technology kind of goes along for a couple of years, and then it gets challenged by emergence of a huge new wave of more complex, more broad applications. I kind of see us, I see kind of three waves having existed so far. The first wave is what I would characterize, for lack of a better term, as kind of solutions looking for a problem. Which is not meant to be disparaging. I mean, that first wave, we saw some really elegant code. This is the wave that kind of paved the way for like everything that kind of came after it. But I think that first wave was never really able to align the tech with the clinical use cases. And so a lot of those early players either kind of went away, or they pivoted, or they got acquired, or they just kind of changed their strategy. And that kind of led us to wave two, which is kind of the market dominant wave right now. And it's comprised, I would say, mostly of single point solutions. So algorithms out there that will spot a pneumothorax, or find a pulmonary embolism, or detect an intracranial hemorrhage. And lots of clinical value, added, by these tools. And like I said, I think I've achieved a certain market penetration and have gone a long way toward convincing people that AI is here to stay because it adds value. But this wave is being challenged again by a new wave coming out, kind of like a wave three. And Annalise is part of this wave three. There are others in the space, and these are companies that are building these broad, multi-finding algorithms that stretch across an entire modality. So instead of solving for pulmonary embolism, we're solving for chest CT. Instead of solving for intracranial hemorrhage, we're solving for head CT. Much different approach, and we think one that will unlock a lot of new value opportunities for customers around the world.
For quick follow-up on that, so I guess maybe two subsegments from an IT perspective, and then from a radiologist kind of clinical process perspective. How does this multi-finding approach differ from what we've had up until now?
Well, so on the IT front, the IT story is really one of integration and ease of use. I think we've evolved there as well. We've kind of we've gone from the area where if I'm reading a study here, I have to like go over here, to use the AI. That is going away, and has certainly gone away as far as Annalise is concerned, and for most of our current competitors in the space as well. We're integrated pretty seamlessly into PACS. We also have solutions that are deployed onto machines. So like we have for example, a collaboration with Fujifilm, where we're actually we have a version of our chest X-ray algorithm actually physically deployed on an X-ray machine. And so there's a variety of different kind of IT integration plays, but I think in general, the common theme there is that integrations are getting more and more seamless, less and less intrusive to the radiologist workflow, because that's what radiologists have asked for, right? Now you asked about the clinical implications of having all of these algorithms. And that's been really interesting for me to learn about, kind of having come into the organization relatively quickly. One question that we get a lot is, okay, you have all these findings. That must mean that it's really going to slow me down. because I have to review a lot more findings that the AI is detecting. And oh man, I bet you have like a lot more false positives that you have to go through. And I was of that mindset too when I kind of first heard about these broad, kind of multi-finding algorithms. I was like, that's not going to be very convenient. But then I realized paradoxically, it's actually the opposite is true. So I'll take, for example, intracranial hemorrhage, right? Common indication that everybody kind of knows about. We know there are tools out there to find, a subdural hemorrhage, for example, on a non-con head CT. Well, there's certain false positives that are associated with intracranial hemorrhage, which basically shows up as bright on a head CT. And the false positives are associated with other things that look bright on a head CT. A calcified meningioma is a great example of something that looks bright and can mimic an intracranial hemorrhage. Well, our algorithms actually are trained to find the calcified meningioma. So that's a really, really big differentiator from a generic algorithm that's just looking for anything bright to one that actually knows the difference between a bright bleed and a bright meningioma. And so what I've observed is actually our accuracy rates are actually improved because we have so many of these, because we can differentiate between different findings. And so our false positive rate actually goes down, and radiologist efficiency is actually enhanced over the older generation of technology, which is something I wouldn't have expected and didn't really intuit before I kind of got into the space.
Right. That makes sense. So that what might be a false positive for another tool is a accurate positive for a tool that has all of these different findings that it can identify.
Exactly.
Super interesting. So I guess the other part of the AI evolution, and one that I feel like is a hot topic this year, is basically what's happening in the kind of fundraising side of AI and what venture capitalists are looking for and how they're acting and how they're using the money that they're willing to spend in 2022 and 2023.
Right.
What are some of the shifts that you're seeing and the mindsets that you're seeing, and how's that playing out in terms of the AI startups out there?
Yeah, that's a really super interesting story. I get pulled into a lot of conversations on this topic from folks in the investment community, private investors, VC funds, private equity, family offices, and yeah, so there was a ton of interest, ton of hype back 3 or 4 years ago, as you know. Huge amounts of capital flowing into the sector in 2017, 2018, 2019. And then COVID hit, and now we're in the middle of this global macroeconomic challenge. And so what's happening to funding? Is it tapering off? Is it going down? And my read on that is that no, it's not going down at all. In fact, it actually continues to increase. And if you take a look at, Signify Research, for example, has produced some good data kind of backing that up, that, VC funding is as strong as ever, interest in the space is as strong as ever. Now, what there has been is a narrative shift. And so the reasons for getting into the space, I think, are different. Back 4 or 5 years ago, everyone was excited about AI because we're going to displace the radiologists, right? We're going to eliminate radiologists and we're going to save all this money. That has changed. And now the talk is really more where it should be around quality improvement, workflow efficiency enhancement, population health, that type of thing. The other thing I think that we've seen, the other shift that we've seen is a kind of a flight to quality. And so, a couple of years ago, tons of capital that needed to be deployed, you kind of throw it wherever. Now, I think you see investors really being a lot more careful, doing their due diligence, really kind of being very thoughtful about where to place their bets, which has been good, for us and kind of other kind of high quality firms, of our ilk. And kind of plays to the whole, all the consolidation, that we've seen in the healthcare sector at large. Now, it's probably, if we're talking about investment, we probably also have to address another kind of more fundamental question that I think a lot of people are asking in the investor space, which is more broad than just imaging AI, and it has to do just with the question of whether all of AI, across the entire healthcare sector, does AI really offer long-term differentiated value and the opportunity for long-term shareholder returns? And I think that the majority of investors are still very bullish about AI, but there's a minority, a significant minority, but that are kind of like raising their eyebrows and saying like, "No, wait a second, maybe this isn't worth all of the attention that we've paid to it." And thematically, I think there's been kind of 2 avenues of pushback there from the VC community. The first is this idea that like, hey, all this stuff's going to become a commodity anyway. Data is really plentiful. It's easy to build a model. It's all going to become a commodity, and in a commodity economy, profits go down to zero. So why would I invest? So that's kind of like the first pushback. The second pushback has more to do with the amount of benefit that the stuff delivers, right? And so here the argument would be, well, yeah, I see the value of these algorithms, but if it's only increasing my quality by 1 or 2 percentage points, if it's only bumping up my efficiency by 1 or 2 points, that's great, but it doesn't really overcome my investment hurdle. It's just not enough. It doesn't get me excited. So I'll sit out. And I think both of those arguments are really important to pay attention to. I have a response to those, which is to say that I think they're valid. And I think that they are potentially applicable to some of the older technology, that we refer to. I think that it is fairly easy to build a single point solution model, for example. And there is a ton of data, and there are a lot of people who can build a convolutional neural network. But once you get to these really broad and really deep algorithms, I think there's much wider of an intellectual moat around them. And so I think that's protection from the commodity argument for a while. And I think there's a lot of value that can be delivered and captured there. And then as far as the effect size, kind of like the value that the stuff delivers, again, I think that the newer models, the newer technologies are going to drive a step change in benefit to the user. So Annalise has some data, retrospective data from some of our reader studies suggesting that workflow efficiency when using our tools is improved not by 1 or 2 percentage points, but actually by 10 to 12 percentage points. And we're not the only ones that produce this data. There are others in the space that kind of producing similar figures. Now we still have to validate this in real world clinical settings. I have to emphasize that. But if this is true, and if we're delivering that magnitude of benefit, that's kind of the benefit, I think, where the investment community sits up and pays attention. So, long answer, but I think that I think the investment community is still bullish about AI. They're being more careful about where they place their bets. But I think there's going to be continued interest as we roll out new use cases and show this increasing magnitude of benefit to the user.
One of the, I guess, two of the things you mentioned, which probably not intentionally, but it's an interesting trend that I'm seeing is this year is one is AI as a kind of alternative or solution to the radiologist staffing issue. And then the other is just this need for efficiency. And then one of the big stories of this year is this kind of emergence of these autonomous AI products. And obviously there's not a lot of AI firms who are going out there and saying like, hey, you can hire fewer radiologists as a result of this product, but there's some that kind of are leading with products that kind of do suggest that. What are your thoughts on the field of autonomous AI and what it means?
Yeah, no, it's a real hot button issue. In fact, I think this when we go to conferences, I think I'm asked this question more than any other. And I'll reply very directly. As you alluded to, there are companies out there who are marketing products, and in some cases have gotten regulatory approval to market products that select out normal cases. We'll identify your normal chest x-rays or your normal mammograms, whatever. And we'll do so completely autonomously with no radiologist involvement whatsoever. And you can tell from the tone of my voice that I'm a bit skeptical of that claim. And I think Annalise is skeptical as well, but for a reason that I should probably explain, which is that I have a philosophical problem with the idea that normality is a finding, that we can detect normal. That's, to me, is problematic. And there's been a lot written on this by people a lot more eloquent and articulate than I. So if your listeners are interested, there's some great writing by Lauren Oakton Rayner, and she has produced some really, I think she illustrates this dilemma very, very nicely in her writing. And the problem is that normality, there's infinite permutations in the universe, right? There's infinite permutations of what can appear on a scan. So how can we claim to be able to detect normal as if we're detecting, a pulmonary embolism or pneumothorax or whatever? I don't think that that normality is something that we can affirmatively search for, affirmatively identify, and affirmatively rule in or rule out. Instead, I think what these algorithms are doing behind the scenes is they have their list of findings that they're looking for, and they're defining normality as the absence of those findings. So, but that's a little different than saying like we find normal and we'll identify normal. And that's okay if that's what's happening. But my contention is that you don't want to do that as a black box. You don't want to just present that as a black box to the community and say like, we find normals, trust us. The Annalise approach is more so we've got, for example, 124 findings on chest X-ray, 130 findings for CT brain. If somebody comes to us, a customer comes to us and say, we're interested in kind of separating out the normal or the remarkable and the unremarkable scans, for example. The first thing we'll say is like, okay, tell us more. Why do you want to do that? What is your goal? What kind of workflow do you have in mind, right? Are you thinking about just ordering the work list so that when you come in the morning, you're all fresh, you have your cup of coffee, you can kind of hit the hardest studies first? That's one reason you might do it. Do you want to batch read the unremarkables? Have somebody sitting in a bunker somewhere batch reading the unremarkables? That's there's a bunch of different reasons why you might configure a work list that way, but you want to understand the intended use before you kind of tailor the product to that use. And then after we kind of have that conversation, then we do exactly that. We tailor the product. So we are very transparent. We say, look, we have these 124 findings. Let's configure the tool to meet your needs and say, okay, these are, which findings are you going to say is normal? Which you're going to say is abnormal? Do you want to call cardiomegaly normal? You want to call it abnormal? And then for each finding, not only are you configuring it to say which is normal, abnormal, we're also adjusting the threshold. And actually on a finding by finding level, fine-tuning the threshold to meet the need of the site. That to us is a lot more transparent and useful a process than just kind of having a black box. And of course, this configuration and tailoring the product, that's all, we have to do it within the bounds of what the regulatory authorities in that particular jurisdiction allows. I have to say that. But ultimately, we want to work collaboratively and in a consultative process, with customers to design the right solution. And so, and just, I'll just finish up by saying that as far as truly autonomous reads, I think, will we get there? Maybe. How quickly are we going to get there? I'm not sure, but I think we have to be very thoughtful and very intentional as we progress along that pathway. I think workflow triage to me seems to be a much sounder intermediate step than full autonomous reads. Now, we may go very quickly to autonomous reads if that's what the radiology community wants, and if we show that it can be deployed safely and with patient health as the ultimate true north. But we as a company want to do this together with the radiology community. We want to work with organized radiology. We want to work with regulators. We want to work with market stakeholders to make sure that we're doing it in a thoughtful and intentional manner.
Actually, I'm familiar with the article from Dr. Oakton-Rader, and I thought it was excellent. And what is normal is a really great point.
You covered it, I remember, in an imaging wire. I remember. I think that's maybe how I first found it, was through a link from the newsletter.
All right. Well, it's easy because her blog was like my very favorite, and she put out some great research. So one of the things you were talking about, which is, I guess, super important, is essentially just what radiologists are ready for. And obviously that's been evolving, but how do you see radiologists' adoption and their evolved perception of AI, and how is it changing over time?
Yeah. Well, again, so there's been a lot written on the kind of the general topic of innovation and technology adoption. There's a lot of great work on entrepreneurship, on kind of technology diffusion, on incremental innovation and intrapreneurship, the kind of innovation that any firm, including a radiology group, has to go in order to kind of sustain their competitive advantage. And I've actually contributed a little bit to that literature with my friend and mentor, Jeff Rubin from the University of Arizona, who's very, very thoughtful about this kind of stuff. But at the end of the day, I think that in order for new technology to get adopted, I think you need three things. You need supply, like you need supply of new technology, new ideas. You need demand from the eventual adopters. and you need resources to make sure that everything can actually happen. So, where are we with AI? Well, we definitely have supply. I mean, there's a bunch of companies out there, very well funded, a bunch of enthusiastic entrepreneurs with great technology. And so I think the supply is there. I think the resources are there. We've got the data, we've got the GPU, we've got the talent pool across the globe, to kind of really propel AI, in the next, kind of next generation and beyond. And the question is, do we have the demand from the field? I think that the answer is yes. And I wouldn't have said that necessarily a couple of years ago. I think people were a little reticent and a little kind of reluctant to be thinking about AI. But I kind of feel like we're passing some kind of inflection point. Well, that term is overused, but I think we are kind of passing some kind of inflection point where I think soon a lot of these algorithms are not going to be nice to have. I think they're going to be need to have. And it all just kind of tracks back to increasing awareness of the need to improve quality and the way that we improve the way we serve patients. Also the need to enhance workflows and be more efficient, given financial pressures. And then also just a realization of how these tools more broadly can be used to advance global health. So I think we're at that, or at least approaching that perfect storm situation. We'll see. We'll see over the next couple of years how things change.
So far we talked about how the products are getting better, and the folks funding AI startups are getting better at picking the right solutions to put their money behind, and then demand is picking up on the clinical side. So that seems to be things heading in the right direction. When we look further ahead beyond this current wave towards multi-abnormality detection, what do you see as the kind of the future waves of growth and evolution for AI?
Yeah, I get this question too, also from investors a lot who kind of say okay, but wave one was the solutions looking for a problem. Wave two is a single point solution. Wave three is the broad, multi-finding algorithms. What's wave four, right? I think wave four to me is integration of AI technology across the value chain, both upstream and downstream from image interpretation. Of course, Annalise right now is kind of located in that AI for imaging interpretation space, but as all of your listeners know, there's tons of value opportunities upstream of image interpretation, everything from exam selection to patient scheduling to boring but important stuff like prior authorization from payers. Those are all areas where they're very ripe, I think, for technology to come in and innovate. Downstream as well. Care coordination, charge capture, business analytics, again, very promising territory. And it's not to say that there aren't players. There are players, at every space along that imaging chain. But for now, I haven't really seen a lot of integration among the different players. And I think that there's a lot of opportunity for integration, like I said, kind of up and down the value chain. Annalise has plans, not to just remain in, squarely in image interpretation, but really to develop a solution suite that really does extend up and down that value chain on behalf of our customers. And there's obviously other people with that intention as well. But I think that is, I think that to me is wave four. And I'll tell you, if I really kind of squint my eyes and look really far ahead, or maybe not so far ahead into the future, I think there's a wave five there as well. And just real quickly on that, I think wave five to me is taking this unbelievably rich data set that we all know that we're sitting on and that is just so underused, really, and learning how to deploy it outside of radiology. I think that to me is wave five. And I'm certainly not the first person who's kind of talked about the value of multi-omic data sets. I mean, that idea is pretty old at this point. But I really believe very heartily in it, that we will be able to one day harness the vector output from all of these AI tools and combine insights from not only from imaging, but also from pathology, genomics, laboratory, EMR, claims, pharmacy data, and generate new insights for the healthcare industry, insights for how to treat patients, insights for how to manage risk, for financial risk for patient cohorts, and also just how to better advance global population health. So I could finish up there, but I will say that, kind of going back to that question about investors and kind of like what they see in these AI companies, I think it's probably safe to say that a lot of these investors, these kind of far-looking investors, are really thinking beyond wave 3 and probably even wave 4, and they're really setting their sights on wave 5, because I think that's where the real magic begins and where we really start really dramatic transformative change in the healthcare industry.
This is really exciting stuff. It's cool to think about, all the things that are going right now and the good directions that we are going in this space, and what that could bring us, and whether it's, better functioning through upstream and downstream value, or kind of that next gen multi-omics analysis is really cool. And the idea of using AI to analyze an entire chest CT or head CT is really cool too, and feels like a step change from stuff that we were talking about last year. So that's awesome. And kudos to you, one, for just having such a strong grasp of what's going on and where we might be going. And then to everything that Annalise is doing, and really just changing the way that we look at a AI tool for a given modality or exam. It's really neat. Dr. Abramson, thank you for coming in and sharing all this stuff.
Thank you, Jake. Really enjoyed it. Thanks so much for having me.
It's great to have you on. And for the folks who are watching, hopefully you enjoyed it and gave you some new ideas about what you can be doing now with AI, with tools such as what Annalise is doing, and then, what to expect going forward and how to prepare your own clinical operations for that. Thanks again for coming on, Dr. Abramson. Thanks for watching, everybody.